All right. Good afternoon. Good afternoon. Welcome to Connecting with our public health partners here in the Fairfax County Health Department, our Black History Month edition. We are joined by Executive Director and founder of the African Women's Cancer Awareness Association, Ms. Nwabukwu, and survival advocate, Ms. Esther Peters. First of all, welcome, ladies. We're so glad that you chose to join us in this partnership and this work. My first question is this. Let's get right into it. What are the most obvious disparities that you see with African and African American women when they are diagnosed with breast cancer?
I'd like to thank you for having us this afternoon, and I'm glad to be here. So when we talk about disparities among the Blacks and Africans, I want to say that access is one of the first ones that I see or I notice. When I say access, it means for at least people in the African immigrant community, is the ability for them to be able to go for early screening.
Right.
We go out and we teach them, make sure you screen early. But we also know that if they don't have access, the ability for them to go for this screening, sometimes simple things as just the referral. They cannot just go in and ask to be screened. Some of them don't even have providers to write them that referral. So these are basic little things that we have to find ways for them to overcome so they can go for those early screening. I also know as we teach and ask them to go for screening, they need transportation. So sometimes there's this transportation issue. Half of them rely on public transportation. Some of our partners do their screening like early on Saturday morning. And I understand that some are in certain areas, the public transportation do not start running till, a little later in the mornings. And so we use this opportunity to partner with those other companies that can also help us provide transportation. And so sometimes members of our community also volunteer to pick up these individuals to go for screening. So whatever it takes to help them to meet and go for screening, we keep preaching early screening, early detection saves life. So we want them to do that. And I'll have Ms. Esther talk about the insurance and other areas.
Thank you, Ms. Ife. Yeah, in addition to all of this barriers that Ms. Ife just talked about, we also encounter patients or clients who are either uninsured or underinsured. They could be people who do not have insurance at all, and they need these services. Of course, we have to find a way because we do have partners that are able to screen our patients or our clients without insurance. And then there are also people who do have insurance, but insurance does not cover for some services. So again, we have to bridge that gap to ensure that we take the people to the services they need, or bring the services to the people that need them.
Yes. Thank you for that.
Yeah.
My next question is this. What do you tell Black women about breast cancer prevention specifically? And not just Black women. Obviously, we know that men get cancer as well. What do you tell people about breast cancer prevention?
I would like to say that for that, there are quite a number of factors. So one of the best one I like is family health history. Why I say that's the one I like is how often Do we discuss with our children, our spouse, about, what illnesses or diseases in the family, let alone what did Aunt Mary die from? What did Aunt Jemima die from? Those things are things we never talk about. It's like almost a taboo to tell your kids, do you know this is happening? And
Absolutely.
I've even had cases where the lady will not tell her spouse she's going through breast cancer. So things like this, it's a hush-hush thing.
Yeah.
It's about time we talk about it. And I'm glad that there's more openness these days. So once you know your family health history, that better prepares you to make sure you're doing all the right things, either to prevent it or to at least delay the onset. So these are some of the things we talk about. We also want to tell women folk, it doesn't matter blue, green, black, that you've done nothing for you to have breast cancer.
Wow.
If it comes, then let's work with it. There are a lot of resources. There are people who are here to walk the walk with you. So us being too shy about it, making it a taboo, those times are past. There's so much out there to help you get through it. God willing, some people still succumb to the disease, but we want you to know that there's help out there. There are resources out there. And technology is changing, things are happening, things are changing. So we need to be able to talk about it and do something about it. So, Miss Esther, you can add some more to that.
Yes, Miss Ify. Yeah, like we always say, breaking the silence. We try to break
Yeah.
the silence. Like Miss Ify said, there's nothing to be embarrassed or ashamed of. It wasn't because of your sin, or it wasn't because you did something that you could be eating healthy and eating all organics and still have cancer. Cancer does not peak its victim. It does not peak. But the most important thing is knowing how to prevent it, knowing your family history, and going for the screenings, irrespective
Yes.
of what kind of cancer. If you're a male, you get to 40, you know what cancers to be screening for. The prostate and the colon. If you're a female, of course, with insurance, of course, breast cancer is the first thing for female. Cervical cancer from the age of 21, we have to throw that in. So, there's a lot of education that goes into this, just to prevent all forms of cancer. And the most important is knowing your family history. If you've had a paternal, maternal aunt who's been symptomatic or who's been diagnosed, you should know what to be looking out for. Understanding your body, knowing how your body works. If you know how your body works, you know when there's a change, something different, and then you seek help immediately, because there are tons of resources out there to be utilized. And we want our people, Black women, to know that they can benefit. Cancer is no longer what it used to be some 20 years ago. You can get help, you can get treated, and you can continue on living your beautiful lives.
Yeah. Thank you for that. That just really makes my soul vibrate. It's about advocacy and awareness and knowledge, as you've said. My next question is this. What are your strategies or your methods for reaching underrepresented communities? I guess what I'm asking is, how do you raise awareness about this wonderful organization? I know you have a pretty high profile in the DMV area, and I found out about you through your outreach events. Can you tell us more about that, please?
I think for us, one of our methods is to meet the people where they are.
Yes.
When I say that, I mean that we willingly and happily go to any places of worship, to the churches, to the mosque. During the summer, we go out to the parks, family reunion. So wherever you have a collection of people, there's food, there's music, and a little bit of education. So while we're talking and laughing and eating and drinking, we also want to raise the fact that we want to be healthy. So we want to pick up all the good habits that will help us to live longer, to stay longer. And if for any reason you're one of those that at some point in your life, you're diagnosed with cancer, any cancer, but specifically breast cancer, there's hope. Things are changing. We want you to be your own best advocate.
Yes.
Know your body, know your breast, know the color, the size, the shape. And if anything changes or goes wrong, we want you to be the first person to know that something is not right or I'm not feeling right. We also want you to know that it's not the end of life. Yes, a few percentage succumb to it, but yes, there's a greater percentage with modern technology, with improving technology that survive. So we want you to survive and we want you to thrive after breast cancer. And we want you to be a happy survivor, a happy camper saying, yes, cancer came, I beat it.
Wow.
Yes.
Jennifer.
Yes, of course. And, I just picture like a big bell, like when people, like just cheering on, and it's beautiful. And it got me thinking as well of like the network and the web of women that you've touched throughout the years. And my question to you is more of how do you, how have you built this network of survivors throughout the years, and how have you engaged them through not just outreach events and all that, but through your organization as well, and like the backbone of the organization?
So we have a strong support group
Hmm.
here in AWCA, and that support group is made up of breast cancer survivors, people, but again, now we also have people who have been diagnosed, So what we typically do is as soon as you reach out to us for assistance, with your permission, you are added to the group. And we call that group Iroko Support Group. That word Iroko is befitting because the Iroko is a very strong, powerful tree, a very big tree that has, withstood different kinds of weather, temperatures or climate changes. And we just feel that that's the most befitting word for every woman who has beaten and survived cancer and is thriving and doing everything she can to stay alive for herself and for her loved ones. So what we do in that group is we provide solidarity. We share experiences. I usually take myself as a show and tell. I remember when I commenced chemo and I was losing all my hair. That was the most depressing part of the whole diagnosis and treatment. I mean, the
I'm
chemo
sure.
do some damages to your body, but losing my hair hurt so bad.
Wow.
Mhm.
I went online.
That's a big thing with Black women.
Mhm.
Yeah.
Then I went to my doctor. Of course, I was excited to find that there was hair prosthesis out there, and I got a prescription for hair prosthesis, and then I went online because number one, my insurance wasn't going to cover it. My insurance wasn't going to cover for that, of course. And then I went online. I couldn't find a place, within my area. I couldn't find any store that could, provide the hair prosthesis for me, and that really hit me. It hit me hard. Looking at myself in the mirror, bald, going from being very hairy to being bald.
Right.
But guess where I drew strength from?
That support group. Everybody.
Yes, I looked at the women. Some had
Yes.
experiences like 17 years ago. Some were like 3 years in, and people like Miss Ify. Look at all the hair on her head. I'm like, okay, there's hope. There is hope, and this is me today. This is my hair.
Wow.
And I just beat cancer I just finished radiation April of last year.
Wow.
Wow. Congratulations.
Thank you.
Congratulations.
Thank you. So we do this to all of us. So we have people who are currently in treatment. We have people who just finished surgery. And this is us telling them, hey, look at us. You can do this. Your skin will come back.
It seems like I've heard you say that some of the most vehement advocates were once clients. So
Yes.
tell us, it seems like you're building capacity within the organization with these ambassadors, I think is what you call them. Talk to me about that.
We are. So see how excited I am about this? This is how the survivors are, because once we talk about AWCA activities, they come in the numbers because we know how much this means to us. It's important that you have people who look, sound, and understand, people who look like you, sound like you, and understand the journey. Because sometimes even your family won't understand.
Yeah.
Usually, if you've been the typical Black woman carrying the cross, the yoke for the family, sometimes people don't understand that you also need someone to understand and see you.
Yeah.
And this is the support that we provide. So, I mean, small wonder when we survive and when we beat the cancer, we want to stay here. We want to continue the support. And in our meetings, we're always providing support, whether it's fixing a meal or ordering a meal for a sister who is sick, who cannot cook, or calling someone to talk to, just knowing that there are people here. And then when we have our outreach events, of course, it's the survivors that are out there assisting in the education. We have trained community ambassadors. These are all survivors who are willing to put the word out there and hold the next person's hand and say, hey, I did this and you can do it too. So this is us in a nutshell.
So what I remember the most about the sisterhood in the survival group is when one of us lets us know if they're scheduled for surgery. As best as we can, we send somebody else to go be a source of support on that day. Right. And I know that when I had to go for my own surgery, I had one of the survivors came in with her husband 5:30 in the morning before I came in.
Wow.
I never in my life can forget that. They were there to show support. They were there before me 5:30. I came in at about 6 o'clock. My surgery was for 7:30 that morning. So the emotion comes in because these are vulnerable times in your life when you need somebody, when you need someone to tell you, you'll be all right. There's hope. We're here. We're praying for you. We're in this together. And so that's what I want from all of us women, to be there for each other, to make sure that we're not letting anybody walk through this part alone.
Right.
Yes.
So that's, if my whatever I say today don't resonate, I just want us to know that we're here to support each other.
Yes, ma'am. Yes, women supporting women. Well, that's what we love to see.
Yes.
We love to see our families, our neighbors, our community members be uplifted. And it's through people like you that we're able to, continue this work. And you were mentioning, Miss Esther, about the tree, the Iroko tree. It's a beautiful metaphor too for all the work that you've done. And, it really puts like everything into perspective when people say grassroots, like you really have started, with people who share their stories, and now you're able to uplift people in different areas, not just in Maryland and DC, and now you're coming over to Virginia and expanding your reach there. So it's like a big tree with many branches and touch many lives, and it's really truly beautiful that it all comes and it's very full circle. And thanks for all that you do. And I guess I'll throw just one last question to you all is how do you plan to, or how do you envision your work continuing here in Fairfax County and expanding your reach to women and doing the amazing work that you do?
Tell us about the partnerships.
Yes, yes.
I'm glad you said that. I definitely want to be here to say thank you. Thank you to all our partners, to Fairfax County Health Department for having us today and for our new relationship and partnership. Thank you to Howard University Cancer Center. To Breast Care for Washington, we say thank you. To Luminous Health, thank you. George Washington, thank you. To Georgetown Lombardi Cancer Center, thank you. Inova Hospital, we were there today, and it was to form a new relationship. We are so excited to be in Northern Virginia, to work with them, to be able to reach our community and all the Black folks and everybody else, because cancer does not discriminate.
No.
And we are there for everyone that could use our resources, that could use our voice, that could use our help. So we thank all our partners. We like to continue to grow like the tree, getting new branches, more leaves, so
That's
we
right.
can continue to do the work.
Oh, yes.
We thank you for joining us. If I had a glass, I'd lift it to you and offer you a cheers. Thank you for your
Yes.
partnership. Thank you for the capacity you've built in the community. Just thank you for the work in undermining disparities that Black and African women experience when they are diagnosed with cancer. Thank you for helping survivors become thrivers.
All
Yes.
right. Absolutely.
Thank you so much.
Thank you again.
Yes.